Well, you mentioned about testosterone for women. So how does that
Mhm.
affect sexual health and affect the local symptoms that you might be talking about?
When you look at traditional like method of treating somebody with pain intercourse besides say pain medicines, the other thing a lot of times used is just straightforward topical estrogen, which is good. But the thing is that it needs to be balanced with testosterone, especially in the vaginal area called the vestibule. That's the area where you have predominantly most painful intercourse. If you just give estrogen without testosterone, that area is very testosterone dependent. And so we need to complement the estrogen with testosterone. And usually testosterone is a 10-to-1 ratio of estrogen. So,
I agree 100%.
and
I can tell you with our patients, testosterone, like for atrophic vaginitis or vaginal atrophy, just the breakdown of that tissue, I don't think there is a better drug than testosterone to help for atrophy. I think, like you say, estrogen is great, but testosterone is even better. I think they work great together, just like you said. So speaking of testosterone, what about the misuse of testosterone? You say testosterone is important for women. What about the misuse of testosterone for women? I get questions all the time. Am I going to get big muscles? Am I going to grow a beard? Am I going to get a deep voice? So how do you address that with your patients?
so the problem comes in is that when you give testosterone, somebody starts to feel better. They start to have more energy, more strength. They feel like they can work out. Their sex drive increases because testosterone helps with that. The problem is that if you give them too much, they're going to feel great. Problem is over that you won't notice the negative effects for a while. And so if you're continually having too high of dose, then you worry about problems with your, as far as your muscles, with your heart, with your lipids, and other issues too. And what has to happen, you have to look at their blood work and say, we need a 10-to-1 ratio of this and estrogen, and they need to be balanced. We also follow what's called sex hormone binding. Well, this is what binds testosterone, and you have a little bit that's free. The reason we do that is because I look at like a teeter totter. If you have too much estrogen, you're going to pull down your testosterone, and vice versa.
Mhm.
Well, if you balance it right, it should be good. If it's not balanced, you're going to get problems from estrogen